Good morning, Wakefield. Sorry to keep you waiting. I think we're about 9 minutes late today, and that just shows you how much on the fly this whole COVID-19 experience has been with us. So welcome. We have online today, we have Health Agent Ruth Clay. We have our Communications Director, Jen McDonald, Superintendent Doug Lyons, Laurel Gorval from the Health Department, Town Council Chair Ann McGonigal Santos is here, and I do see some members of the public, so thank you for joining in. First off, we'll start. Positivity rate of 6.75%, which still puts us in the red with another 221 communities in Massachusetts, which is, I guess, some sort of a benefit because last week there was 229, so it's down 7. Unfortunately, we weren't one of them. But last week our numbers were 8.54% positivity, and this is 6.75%. So we are certainly moving in a better direction. And I do thank the community for doing what they can, wearing a mask and staying safe and socially distanced. And I know we're all starting to chomp at the bit on that, but please, let's be vigilant for a little while longer. And I know the cold weather doesn't help. But again, the best thing you can do is wear one of these to protect yourself and stay apart from people. If you look at our map, the surrounding communities, you can see we are, within that sea of red. And but hopefully in the next couple of weeks, we'll see that go down. We'll be part of the groups that get out of the red. Not that that's dispositive, but it does show a little bit of what's going on in the community. Our COVID dashboard, which will pop on right now, and then we'll talk about our own COVID one inside. We'll show the trend. If you could pop that third one on, Ian. Nope, there you go. So this shows the trends that we do have. There's a lot of information here, and there'll be more to add to it. I do suggest that you do look at that on the town's website. It does show, like the rest of the area, the rest of the country, how those average daily cases were completely jumping, and that is really too bad, but please refer to the website and we'll maybe look at that again later. But let's switch gears a little bit and talk about something that's much more positive. I think we did mention last week on this program that Wakefield will be looking towards, offering vaccines to our first responders. That went very well over the weekend, and also eventually to the different groups per the state guidelines. So that is coming. That's happening, and not happening soon as we'd like it, but we can only vaccine what we can. I do want to say to the community out there that, again, this is happening on the fly. We do not know, for sure when we're going to get all of these vaccines. We put in the orders, but we hope they come in. Right now, what we're doing is we are ramping up to make sure we have volunteers to, when we get to the general public, we're ramping up that we do have a space to disseminate the vaccines that will not bother or have a problem with other things going on. And Ruth can share that when we get on a little bit later. And we are going to start vaccinating members of what the state calls the remaining members of phase 1 over the next few days with our consortium. So I'm going to dump that over to Ruth please let me know. More information is coming. We need a few more days to get this out because it's really on the fly. So go ahead, Ruth.
Thank you, Steve. Yeah, and I want to reiterate what Steve said, and I think that's been very frustrating for both the public and certainly also very frustrating for us because literally I get new information and sometimes different information on a day-to-day and sometimes more than once a day basis, which makes it difficult to communicate current information because it keeps changing, and sometimes contradicts what we said before. So it's, we're really working very hard. I'm on calls with the state health department 3 days a week to get the most current information, and sometimes more than that. 7 days a week, we're getting information and getting changing information. So I think it's really important that people take advantage of our fabulous website, because we really are trying to keep it as current as possible so that you have the latest information. So, so vaccinations. So the good news is we have vaccinated our first responders for their first dose. And that was done the week of January 11th. So they have received, fire, police have received, anybody who wanted it, their first dose, and they will be revaccinated 28 days later for their second dose. So if you want to pull up that graphic that shows the different groups in phase 1. There it is. Okay. I need my reading glasses now. So as we've been talking about, the state, the whole state is not getting vaccinated all at the same time. This is different from state by state. I'm sure you all know people who live in Florida or New Hampshire or wherever that are doing this differently. So this is the way Massachusetts is doing it. And we have 3 different phases. And at this time, we are able to vaccinate everybody who's in phase 1. So the 3rd bullet was first responders, and they're done. The 4th bullet is congregate care settings, which is a little bit of a misnomer. It really means group homes, safe houses, sober homes, shelters, jails. And they're in the process of being vaccinated. Our staff from the health department have reached out to every residential care facility that we know of in Wakefield and determined whether they've already been taken care of through a different venue, which pretty much they all have been. We're also offering vaccination clinics Monday and Tuesday in Medford and Malden. So if anybody is listening who fits into that category and we did not talk to you, please call the health department at 781-246-6375, and we will give you the information about how you can register for those clinics that are regional, Medford and Malden. So now is a much bigger part, which we're working on right now, which is home-based healthcare workers and healthcare workers doing non-COVID facing care. And we're in the process of putting up on the website, Jen is in the process of putting up on the website a list of the types of occupations that fit into those categories, because they're very large categories. So that list will be on our website. It's also on the state website at mass.gov under the vaccination part. So you can see whether you fit into that category. There'll be a series of clinics starting the end of next week for anybody who lives or works in Wakefield or any of the other 5 communities that are part of our public health coalition, which includes Melrose, Malden, Medford, Stoneham, Winchester, and of course us, Wakefield. And if you fit into that category, you can register for any one of those clinics. Wakefield will be holding a clinic on Monday, February 1st. It'll be at we are planning it to be at the Converse building at 200 Quannapowitt Parkway. The town is finishing the paperwork involved to be able to use that site. It's a great site. We can accommodate a lot of people. And once that site is set up and ready to go online, that link will be on our website. So look this weekend on our website for how you can sign up for the Wakefield clinic, but you can also sign up for the clinics that will be in Melrose, Malden, and Medford. We're doing it at different times of the day, weekdays, weekends, evenings, because most of the people, well, all the people in these categories have a job and are presumably working during the day. So there are evening times also. And if it's filled up, don't panic. We're doing very conservative numbers right now because we still do not have verification on, we placed our order for vaccine, but we have not received verification on how much of that order we're receiving. So we're putting limited slots basically up right now. And if you try to sign up and all the slots are filled, just check a few days later to see if we've opened up more slots. So there's going to be a lot of information coming out on our website, literally happening as we speak. So it's really important. That is our main communication tool for phase 1.
Right. And I
so
think
at this point, anybody who's in phase 1 is eligible to come to these clinics.
And I think it's very important that you must be in phase 1 to be eligible for these clinics. This is not the general public, not phase 2 and moving forward. So if you are not in phase 1, please don't sign up and clog up the system. It's just not, it's counterproductive.
And we really don't want to turn you away, but
And
we will. But
we won't have enough vaccine either.
So please follow these rules. Because I've signed with the state that we will follow these rules.
Right. And again, we're not here to get in an argument with anybody about these rules. This was set up by the state. There's no debate on our end, and I hate to be harsh, but a lot of people have called me and say, I don't understand why this group got in before another group. That's not my call. It's kind of like you go and you dance with the girl that brung you, and that's what we're doing. So as we all know.
You're dating yourself.
I am dating myself, yes, but I want to be clear.
Phase 2 will happen. And when we know phase 2 is starting, that's when we'll be doing much broader communication, perhaps using our reverse 911 system. So again, we don't know what that date is. And when we do, we will absolutely communicate that every which way we know, short of smoke signals, to let people know when we're starting.
So I guess I'm going to jump in too. So even though it says on what the state website put out, and this is their form that you're looking at now, phase 2 starts between February and April. That doesn't mean February 1st you can start signing up for your vaccinations if you're in anywhere in phase 2. It may be February, mid-February, maybe March 1st. We don't know just yet. So
if you can scroll down to where that, yes, that. So this is also from the state, obviously. And this is the state's website, and it's already outdated. So they've had this up that says which group can be vaccinated at which time. And it still says that we have to wait till February 1st to do those last 2 groups. That's outdated. It's wrong. As of now, anybody in any of those 6 categories can be vaccinated now. So yes, it is confusing.
That's from this morning.
Yes, I know. They haven't, I know, they announced this on Wednesday and they still haven't updated their website. So, but look at our website.
okay. Let's talk a little bit about the need for volunteers, if that's okay. I'll jump in and then maybe we'll scroll around after that. So when we do get to phase 2 and phase 3, as you saw there, we are going to need a lot of volunteers to help out with this. And think about this in the town of Wakefield, and I'm thrilled that we're taking this on, and not every community is going to do this. We're going to probably give 40 or 50,000 shots. So remember, everyone needs to get 2 at this point, unless there's something else that comes out. Earlier, there will be on our website a ability to sign into as volunteers. And I'm certainly asking you to do that to help out. And, you know, because we're going to be running this 6 days a week, maybe 7 days a week when we get going for a few months. And at the 200 Corner Powered Parkway area, which was chosen for a lot of reasons, plenty of parking, easy access in and out. And we certainly didn't want to say to the school department that, hey, we can do this, but we have to take over your building or a portion of your buildings, and we're gonna have 1,000 people coming there every day while school is in session, or it's gonna be completely remote. So I do see some school department people on there. Maybe they're happy with that decision. Maybe they're not, but that's a decision that we made because we certainly couldn't do that. So I want to thank, you know, the owners of 200 Corner Powered Parkway for opening their building to us. It's vacant right now. For those of you that don't know where it is, I'll date myself, the old American Mutual building. Newer people say it was the Converse building or the DRT building. So that's the building at the head of the lake there. Also want to thank attorney Brian McGrail, who represents that company, for being very instrumental in getting us to the ownership quickly. We put this together in a matter of, we're talking in a matter of days and hours. We were actually there to view the building. So thank you very much to him and his service to the community. So right now, we don't know if you're a public when you can sign up for that, but stay tuned and hopefully we'll give you more information. Ruth, did you want to jump on any more on that issue?
Just on the volunteer part of it, we will need healthcare providers as well as lay people. We actually need just as many lay people as we need healthcare providers. And when we're talking about healthcare providers, we're talking about RNs, LPNs, nurse practitioners, physician's assistants, MDs, EMTs, paramedics. And I'm happy to say that we have a number of our firefighters who are EMTs or paramedics that are most anxious to get involved. So there's that is one whole section of types of people we're looking for, as well as non-healthcare people who will be either greeters or indoor traffic control or working on a computer. So there's a lot of different skill set. There's lots of opportunities. If you need to sit, you like to stand, whatever, you know, whatever works for you. We'll have 4-hour shifts. And again, they'll be in the evening or the morning or the afternoon. So there's lots of opportunity. And I think this is an awesome opportunity to be part of history and part of the community history. And Wakefield it's just that kind of community. And I'm really looking forward to this.
Right, and we need, you know, hundreds of volunteers, really, because it's going to be a long haul to do that. We will have up on the website a email to volunteer. It's not exactly up yet, but we will have that up shortly. There'll be, you know, some sort of a form to fill in, you know, where your expertise lies. So that's all coming up. This is all moving very, very fast, and we're pulling this together as we speak. In fact, I have my IT department, or our town's IT department, up there right now, putting IT, you know, putting wiring and cabling and making sure that we have Wi-Fi up there. So these things are happening as we speak. I'm very proud of all of them. Jen, did you want to add anything from a communication standpoint?
Nope, just if you're on live, you can check the chat. I tried to put links to all the things that are being covered here.
Great. I'm going to jump over to Ann Santos. Can you join us? Ann has her presentation picture up there today, so.
Sorry, I'm in the car, so I had no idea what that camera would look like. No, I would just echo that Wakefield is at its best when it faces challenges. We have seen that in the past, and I'm so proud to be a member of this team. And thank you all, those who are doing 1,000 times more than I am, certainly. So thank you.
Thank you. Thank you, Ann. I'm going to jump over to the, Laurel, did you want to say something? You just unmuted yourself.
Oh, I was just anticipating. But sure, I mean, 2 comments. One is I just want people to rest assured that we've been practicing this drill for years.
True.
When we first came, when I first came onto the board in 2009, we faced the H1N1 mass vaccination effort. And at that point, it was all public health people who were doing things that actually opened up opportunities for pharmacies to do it. I actually think in this case, especially keeping social distancing at 6 feet apart, that a bigger clinic like what we're proposing is more appropriate and we can really get it done. So I would say rather than on the fly, that this is rolling information and where, it's just a very fluid situation, but we have practiced this again and again in our incident command management. And so our core team is excellent at this. And I just want to reassure people that as they come in to volunteer, we'll give them good information, we'll give them good support. And I think it will be a fabulous team effort. We'll get it done.
And I forgot to mention probably the most important part of helping at the clinics is anybody who helps at a clinic can be volunteered can be vaccinated at the clinic. So you don't have to be part of that cohort. You will be vaccinated if you want also.
Thank
It's
you.
a big thing.
Thank you.
Well, and it's very helpful for the people who are working there to have had the experience, because it actually is kind of part of also our information campaign for people to understand, yep, we've experienced it. It's safe. It can be painful, as any shot can be, but it is, everything that we've seen is within the realm of the experiences we've had with prior vaccines. And I think that's, I think that's really a powerful message. I've still had some people who have an awful lot of reluctance with vaccinations, and I think we have to literally shoot our way out of this situation, meaning giving vaccines to as many people who we can reach.
Great. Doug Lyons, any update at the schools, my friend?
Thank you very much, Steve. I appreciate it. It's been a busy week for the schools, a lot going on. Want to just give a shout out to our Greenwood faculty and staff right now that are going through a lot, and they've really had an amazing week, and they've banded together and really supported one another. A quick update on COVID for us. So right now we have 23 new cases this week. As the numbers at the state level are flattening a little bit or declining in Wakefield, so are the numbers in our schools. And so we have 23 new cases for the week. Our quarantine numbers are 148 students and 13 staff members at this point in time. Our mitigation strategies continue to work really well in our schools, okay, in terms of keeping people safe and being able to keep our schools open. Total number of cases to date are 145 students and 40 staff members. Because we've been able to our nurses and our Board of Health have been able to effectively contact trace this week, and we feel like we've really done well with our mitigation strategies and safety strategies. We will continue in our hybrid plan. I want to especially thank Ruth Clay, who vaccinated a few of our nurses to start, because they're going to be volunteering at first responder clinics. I know the remaining core of our nurses are also in phase 1, which we look forward to getting them vaccinated. And we know our teachers are waiting as well, because we think that that's really going to help us to get back on a more consistent schedule. And we really feel like that's going to be the next area for us to really focus on. In regard to testing, we continue to test on Sunday mornings. We tested 304 people this past Sunday morning. We had no positive cases. We will test again this Sunday, and again, that's for faculty and staff. And so we look forward to that. We are working with the Department of Elementary and Secondary Education and a webinar today to learn more about pool testing. We still have a number of questions that are really kind of keeping us on the fence of whether we're ready or feel like committing to pool testing is going to make us more efficient or safer. So that's something that we're still looking at. So that's where we're at from schools. Want to thank everybody for the ongoing support this week.
Thank you. So anybody else have anything to add? I'll wrap up a couple of things. So I guess the key takeaway is that we are going to be completing phase 1 over the next week or so. With, next week, some clinics starting. There'll be one in Wakefield on February 1st for people in phase 1. Phase 2, we have not scheduled any clinics yet because we don't know when we will get the vaccines. And so you can't register for those. However, shortly, when that's up there, we'll let you know, probably via smoke signals as well. I know Ruth ruled that out, but we can do that. It is leak burning, I think. Volunteers, there will be something up on the website for volunteers. You will get vaccinated or the ability to get vaccinated if you wish when you volunteer at the clinic. And number 2, if you're going to be in there for a long time, we're certainly going to make sure that we take care of you in some sort of compensation. So it's kind of a volunteer / compensation thing. And that will be up shortly. And we need hundreds of people to do this because we're going to be doing this vaccination once we get rolling up in phase 2 and then phase 3, probably for, Can you hear me? You can hear me. Good. I think I unfroze. Did you hear all that, everybody? No, you didn't hear it. To recap. Oh my God, my bandwidth is going here.
IT left the building.
Yeah, I know. To recap, if you are in phase 1, you are the only people that should be registering for any of the vaccine clinics coming up, and only if you're within our work or live in the communities that we mentioned. Wakefield, Melrose, Stoneham, Winchester, Malden, Medford. General public, we're going to ask you to stay patient for a little bit longer. As soon as we know the days, as soon as we know when, we'll be able to set that up, and we'll have a way for you to sign in. However, this weekend, there will be up this weekend or Monday ability to volunteer on our website. Take a look at that because we need a lot of volunteers to roll this out, because it's going to take, a few months once we really get rolling. So I want to thank the community, want to thank the Board of Health, particularly Ruth, want to thank our Emergency Management Director, Tom Walsh, all of the volunteers that we've had, all of the nurses, all of our teachers, all of my town employees, all of you that are working very hard every day to do the best you can for the people of Wakefield, and the citizens of Wakefield for supporting us, number 1, and for wearing your mask and trying to stay safe as you can over the next, we're rounding the bend. I really feel good about it. And as soon as we have the vaccines, we'll be ready to roll. Just want to thank everybody. Anything else to add? Anybody here? You heard that, everybody? Okay. Stay safe, Wakefield, and we'll talk again next week, if not sooner. Thank you.